Very common procedure that I do, and again, this is designed for patients that have not only fat excess, but also some loose skin of the abdomen that, again, despite diet, exercise, being fit, can't seem to improve that loose skin. Very common in women that have had multiple pregnancies and the skin is stretched out, muscles have weakened, or for patients that have multiple surgical scars, C-section scars, or other abdominal surgical scars that need to have their tummy improved. So we'll go through some before and afters here as well. Here's a patient, 5'5", 136 pounds, and she's complaining of this, poor abdominal shape and contour. And here she is after, and yes, there is a scar, but in a bikini that scar is not going to show. And you can see the nice improvement in her tummy, nice flat tummy that she has here. Same patient, this is kind of an oblique view, and here she is before, and here she is after. Again, these photos are at about 6 weeks post-operative. So yes, there is a scar, but that with time that scar will fade. So after 6 months, the scar becomes more white and hardly noticeable. And certainly in the bikini, those scars are not going to show. Another patient that is complaining of this loose skin, and she has also muscle weakness. You can see how her abdomen kind of protrudes like that. And here she is after, with a nice flat appearance of her tummy. And yes, again, there's a scar here, but that scar in the bikini won't show. Same patient, more of an oblique view before, and here she is after, and you can see how even at 6 weeks the scar is really quite acceptable. This is a heavier patient. She's 5'1", about 150 pounds, and you can see how she has all these stretch marks and loose skin and skin that kind of hangs over. And here she is after. Very nice result. Tummy's nice and flat, and also notice this improved hourglass appearance that she has, and that's because during the procedure with the tummy tuck, I'll tighten up the muscles of the abdomen, and by tightening up those abdominal muscles, that helps to narrow in the waist.
Is that corset kind of thing?
Yep, exactly. Right.
You do that?
Yep, that's a routine part of tummy tuck. Yep, I do it almost every time. And so this is the same patient from an oblique view. Here she is before, and here she is after. So, and on her, with typical tummy tucks, I'll remove anywhere from a pound or even less than a pound of fat and skin. In her, I removed about 3 pounds of excess fat and skin. Yet another patient before, and again, she's complaining of this kind of poor abdominal shape, loose skin, excess skin and fat. Exercise, dieting, she can't seem to improve it. Here she is after, tummy's nice and flat. Yep, the scar is about 6 weeks post-operative here. This is the side view, same patient, before and after, and her tummy's as flat as a board. Okay, body makeover, this is becoming more and more popular these days. Essentially what the body makeover involves is some sort of breast procedure, either breast augmentation or breast lift or even breast reduction, and then some sort of body contouring type procedure. So usually a tummy tuck, or perhaps liposuction of the abdomen, liposuction of the thighs, etc. It is possible to combine these procedures, but there is a limit to how much can be done all at once. And typically, I draw the line at about 6 hours of surgery for outpatient surgery. Beyond that, you start to run into some increased risk. So with a 6-hour procedure, I can do breast implants, tummy tuck, and liposuction. Or I can do breast implants and mini lift, tummy tuck, and then maybe something else. So we'll go through a few of these. Here's a patient, typical patient, 54 years old, 5'6", 165 pounds, and she's complaining of some small breasts. She's lost some volume with pregnancy and childbirth, And she also is unhappy with the appearance of her abdomen with loose skin. So here she is at 4 weeks after surgery, and she has implants that are 390s filled to 420 saline implants. And I did a tummy tuck with the removal of about 2 pounds of tissue, and her abdomen is nice and flat here. Here she is again, same patient, opposite view, before and after. And again, the tightening of the abdominal muscles, that's a routine part of tummy tuck.
Can you breastfeed if you get implants or something?
Yes, you can.
Oh, you can.
Yep. I don't guarantee it, but if patients have breastfed before, then after breast implants, they are very, very likely to be able to breastfeed. For patients who have never breastfed, then you really don't know, because not every woman can breastfeed. So again, I don't make that guarantee, but the implant goes under the muscle, doesn't affect milk production, and patients should be able to breastfeed. Another body